once you successfully resign from a PPO plan, some insurance companies will still allow you to assign benefits where they'll continue to send you the check, your dental office check. If you check the box that says assignment of benefits. Other insurance companies will always send the check directly to the patient. Delta, in particular, will always send the check to the patient. They do that, frankly, to make it more difficult for you, Remember, the insurance companies don't care one little bit about you, doctor. They don't. And if you think they do, you're sadly mistaken. They hope your patient never goes to the dentist, because if your patient never goes to the dentist, they're never going to have to pay any claims. So the insurance company doesn't care about you. And so Delta and some other PPO plans will send the check to the patient. That's just another nuisance. And remember the history for your hygiene patients when they come to your office. If they have Delta dental insurance and they come to your office for their hygiene care, they don't have to pay anything. And many patients have the mindset that it's what, Naren? What's the mindset many patients have regarding that hygiene visit?
They think it's free.
It's free.
Yeah.
Well, it's not free. Someone's paying, but their mindset is it's free. By the way, that's why many patients have poor attendance patterns when it comes to their hygiene appointment, because they don't value it. They value it at the amount they paid for it, which was what? Nothing. Sadly, that's another topic for another day. But many dentists are frozen in fear of, and now I'm going to have to collect a time of service, right? And, that's what we teach our clients to do. We teach our clients, yes, because it really doesn't make sense to, think about it for a minute there. Wouldn't it be great? Like Delta, we know Delta is going to send the check to the patient. Wouldn't it be great if every patient in the universe said, hey, once I get that check from Delta, I'll drive right over to your office and hand over the check. But I believe that there's a word for that, and that would be delusional. Because the patient's not going to do that. They're going to cash the check, spend it everywhere else, and not have any money. So ideally, what we want to do is collect a time of service. And the way we teach that, if I can role play for just a minute, Naren, is to say, Naren, now that we're no longer contracted with Delta, they will send you the check directly. They won't send it to us. I wish they would, because it'd be a lot easier for both of us, but they won't. They'll send it to you. And because of that, we ask our patients to now pay at time of service. What most of our patients do is they put today's charges on a credit or debit card. We're going to file the claim with Delta today. It'll be in their hands by the end of business today, and they will mail you a check directly. And you should get that check fairly quickly, very quickly. And in fact, well before your credit card or debit card statement even becomes due. So you're not really even going out of pocket. But if you don't have a check from Delta in, let's say, 2 weeks, I would march into your benefit supervisor at work and let them know that you haven't gotten the reimbursement from Delta, and they can exert some pressure on Delta. And what most people do is pull out a debit and credit card and pay a time of service. Now, let me be very practical about it. Naren, do you think the patient is excited about now paying at time of service when historically they've walked out without paying at all? You think they're excited about that? No, let's be real. They're not going to be excited about that. But most patients find that to be fair. But by the way, in the number of years that we've been teaching that strategy, get a debit or credit card today, you're going to get a check very quickly, and well before your credit card statement even becomes due. And if you don't, march into your benefit supervisor at work and let them know, because they can exert pressure on Delta because they're hanging on to your money. In the years that we've been teaching this, we're not aware of any patient that has ever had to march into their benefit supervisor at work. Why is that? Because Delta pays the patient very quickly, way quicker than you were ever paid. We've had friends of the practice, in client offices report back, hey, I got to check in 4 days, 5 days, 7 days, 8 days, 10 days, way quicker than you ever get it. Now, let's unpack that for a minute. We know that the insurance company doesn't care about you, doctor. We know that. We also know they don't care about the patient because they hope the patient never goes to the dentist. But who does the insurance company care about? They do care about one entity.
Right, the employer.
The employer they're the customer of Delta, the employer,
right.
Because they bought the policy. So they do care about the employer. And as a result, they want to keep the employer happy. And they know the way to keep the employer happy is to keep their employees happy. So they pay them very quickly. And in a nutshell, that's kind of how it works. But there are dentists that are frozen in fear of having to have that conversation where they now have to pay a time of service. So I wanted to share, and I still think what we just described is the best way to handle it by far. You get paid today, check goes to the patient, they get it checked very quickly. And usually after one experience of that, patient, well, hey, this wasn't so bad. It worked out just fine. And, they will continue to stay in your practice and be wonderful patients. Once you retrained them, they're wonderful patients.